Hey everybody, happy Friday and welcome to our podcast, Your Hometown Medical Minute. I'm your host, Hal Brock, and with me as always, Mr. Ed Harrison. He's behind the cameras doing all the technical stuff. Hey Ed.
Hey Hal.
Man, well, we made it through another week. Barely though. We went from 70 degrees to a near snowpocalypse, and that morning of the near snowpocalypse, Ed, what did we have here in Chickasha? An earthquake. Man, I'm telling you, don't mess with Oklahomans because Okies, you got to be prepared 100% of the time because you never know what you're going to face weather-wise. But hey, along with the cooler air, I don't know if it carried the flu and other viruses, but Monday, Ed, we actually had the busiest day clinic system-wide that we've had here at Southern Plains in almost a decade. So just a reminder, and we met her a couple of weeks ago, but family care provider Lacey C. is now available for quick care, which means no appointment necessary. You'll be seen in minutes, and she's available now before work and before school at 7 a.m. Monday through Thursday, and then our regular quick care hours are Monday through Friday, 8 to 5.
She's available during lunch, too.
And I always forget that. She is, and that's important. So if you're at work, you don't have to take a whole day off, man. You just take a 30-minute lunch or an hour lunch break, come over here. You don't have to have an appointment. You'll be seen in minutes. You might even make it back without even extending over that hour. It's pretty cool. So that's good stuff for Lacey C. Hey, okay, Ed, so along with February is known as American Heart Month with Valentine's Day, and so a lot of focus on cardiology, excuse me. But, Ed, did you know February is also Low Vision Awareness Month? And now this is actually a bigger problem than what it just sounds like, Ed. Globally, more than 1.3 billion, with a B, people have some form of distance or near vision impairment. Here in America, more than 2.9 million Americans age 40 or above have low vision. That actually excludes the people that are legally blind because that number over 40 is now exceeding 1.3 million. Hey, and then nearly another 4.2 million Americans age 40 or above, Ed, are classified as visually impaired. So it affects a lot of people, and in fact, by age 75, approximately half of all Americans are going to be affected by some type of cataract. So I mean, whether it's really bad or even just faint, but half, Ed, of all Americans, 1 out of 2. That's crazy to me. So hey,
right now there's 2 of us here, and one of us is wearing glasses.
There you go. Yeah, it's not me, not yet. But I mean, the stats are just crazy. So I mean, I actually signed up to go and see Dr. Hajjari, who is our next guest, and I need to get my eyes checked, Ed. Everybody actually should have it checked every other year because, man, things happen in your vision as we age so quickly. But on the flip side of that, for the youth, just some quick stats right here, and then I'll introduce Dr. Hajjari. 80%, Ed, of children who are reading disabled, and that includes dyslexics, have vision problems which can actually be cured. And so they sit there in class and they're known, and sometimes this creates even bullying options. I mean, it simply comes down to vision, which can be cured if they come in and see an optometrist, see an ophthalmologist. We use Dr. Bellardo, world-renowned ophthalmologist, can clear up most anything through surgery, Ed. And then here's another staggering statistic. 25% of all children have a vision problem that have reported that has been significant enough to affect their performance in school, man. And that's why heroes like my next guest are so important. I'm talking about optometrist Dr. Shaun Hajjari. He's a Norman native, a Sooner, graduated med school, Ed, from Northeastern, so just an Oklahoma guy. He sees patients of all ages. He does have a passion for youth and overcoming these visual barriers in school. Ladies and gentlemen, without further ado, Dr. Shaun Hajjari. Dr. Shaun Hajjari, man, thank you so much for taking some time out to be here today.
Oh, of course, man. My pleasure.
Absolutely. Did you have a good day?
I did. Seeing patients and working out.
All right, good, man. Yeah, Ed, I walked down his hall, actually, because I was trying to get him to come down here, and he was in there. And, your patient care, and because I was just kind of lurking and watching your visit, your end of your visit. your patients love you. Man, I love seeing that. You're a good dude. So what I like to do here on your Hometown Medical Minute is I really want everybody who gets to see these videos to kind of meet and know our doctors a little bit. And optometry vision problems, we were talking some of the stats. It's very widespread, so a lot of people, can benefit from listening to you. So I want to give them, and I gave them a little bit of your background. So Norman native,
right?
OU grad,
That's right. Boomer Sooner.
Yeah, Boomer Sooner. Then you went to Northeastern,
right?
And so that's where you graduated with your OD, which is the Doctor of Optometry, right? Okay, cool. So what got you into optometry?
Well, I will never forget, my sister always told me, whatever you do something that you love.
Okay.
So I started as an engineer major, but I realized I don't want to do that. I wanted to help people with their eyes, because I have myself bad eyes.
You did?
Yeah.
Growing up?
Yeah.
Okay.
So I really know what it's like,
wow.
From a kid to the early age to, now, and how it affected me. And so, I just like to help people, and I think that's what really, truly brought me into this field.
That's so cool, man. And I've said this before, and I talk about this often just to you guys, because I like to thank the people that work here at Southern Plains, because for a profession, to choose a profession where you just want to help people and make them feel better, even if that's just putting a smile on their face, you guys are the most amazing people, and I'm so fortunate to get to do this every day and to get to work with people like you.
Well, I appreciate it.
Yeah, absolutely. So, from Norman.
Yep.
Been Oklahoma, med school, everything. And what brought you down here to... How'd we get so lucky to have you in Chickasha?
Well, I think, one, it's both. I'm lucky to find this, but... after an internship, I was just looking for a job, and I was supposed to go to Ponca. It didn't work out, so this came up, and I saw, this is a wonderful place to bring and help vision,
Yeah.
And I think in this area, especially agriculture, in a way, they can really use it.
For sure. Agriculture, manufacturing.
Right.
We have a lot of industries where your eyes can take a beating.
Yeah.
And if you think about it, manufacturing, some of those jobs, especially with some of the small parts, we have HSI Sensing here in Chickasha. It's a huge employer. They do stuff for the Department of Defense. They have a location out in San Diego, and they're dealing with little hermetic switches that are this big. So, eye problems, and in Oklahoma, and we were talking about the stats affect age 40 and above more than 7 million people. But everybody is affected by vision problems. And so here, what type of vision problems do you see most in our area?
I would say I kind of see a lot, but mainly, diabetes.
Okay.
That's a pretty big one. Yeah.
Okay.
Glaucoma, some age-related macular degeneration.
Okay. Explain that real quick, because when you say macular degeneration, I don't know what that means.
So we all have, it's called the macula, it gives us our sharpest vision, and all our color comes from there.
Okay.
So it's really our central vision that it starts affecting. And so if we all live long enough, we'll all get it.
Wow, really? Okay.
Right. But, I see that, and, as we age, if you smoke, you're more prone for it.
Really? Okay.
For it to get worse. And so that's where I see a lot of, unfortunately, seeing that, and it's sad too.
Yeah. Well, and in our area, I sit on, and I'm a new member to this, but to the TSET, the Tobacco Settlement here. Right. I sit on the Grady County. I'm newly elected to their board.
Congrats.
Thank you. And so, it affects a ton of people. And smoking, we Oklahomans, we smoke a lot. It affects a lot of people. And you also mentioned, thanks for explaining macular degeneration, but you also mentioned diabetes.
Right.
Diabetes is so big in Oklahoma, in our area, and people often don't go to the doctor early enough, and then you end up losing a limb. But explain to us how diabetes affects eyes, and why everybody that has diabetes or who could possibly get diabetes should come and see you first.
Yeah, it's a good question.
Okay, thanks. It was a long one. Sorry.
No, you're fine. I always tell patients the only place that we can see blood vessels without cutting us open is in the eyes. And so when patients have that are diabetic, they have weak, leaky vessels.
Really? Okay.
And so sometimes they'll leak, and then they'll get blood in the eye. And when it gets to that stage, I send them to a retinal specialist. They get injections in the eye.
That sounds very serious. I mean,
right, it is. And a lot of times, and what's unfortunate, a lot of patients don't know they have diabetes, like you said.
Yeah.
And they come in and they said, I just lost a vision, and, it's because of the high sugar or, uncontrolled sugar.
And at that point, and I mean, well, I was doing the stats, and we're about to talk about the schoolhouse performance and how vision is linked to kids, but it's also linked to diabetes and getting... Okay, so in school kids, 25% of their vision or 80% of their vision are things that can be cured. Diabetes the same way. Not maybe can't be cured, but it can be maintained and it can definitely be mitigated if they come and see you.
Right. Yeah. Same with, there's some patients, you can take a pill for it too.
Okay.
But before that, just a regular diet. Walking, exercising, even just walking.
Yeah.
And watching our sugars, of course, I'm bad at. But yeah, we can all control that,
For sure.
before it gets bad.
It's crazy all the things, because the body, everything's connected. You think back to that song, the bones are connected and everything, but everything is so connected to the eyes. I've had you here for a long time, and this is Facebook, so people's attention, it's a little bit shorter, and I talk a lot. But I wanted to double back on the youth issue because it's so big. And I know you have a passion for that. And of course, bullying is such a big thing. And I even have heard that because people have vision problems, they can't learn the same. Some problems like dyslexia or other problems. And then bullying happens and stuff like that. You actually mentioned that you had some eye issues as a child. So what can you kind of tell us about that link and how can you help?
Yeah, that's a good question as well, too. I think, first of all, a lot of parents don't know their kids have vision issues, and it's because in the kids' eyes, what they see, they think everyone sees.
So they don't even tell them.
Right, because they think their parents see exactly what they're seeing.
Okay.
But then, unfortunately, really, they truly have some type of vision issues. When we're about 5 to 7 is a critical age development for vision.
Okay.
And so, I do see a lot of, we call it amblyopia. Basically, it's a fancy word where the brain starts favoring one eye and shuts off the other.
Oh, wow.
And not only...
Why they're trying to develop.
Right.
Makes sense.
And so it hits hard, it hits me at home because I feel like for kids to not struggle as they go through their lives, they need a good foundation.
Yeah.
And a lot of patients or a lot of parents think their kids have ADHD or something, but it's truly vision related, just what you were saying.
Yeah.
And so I always recommend they get your kids checked, especially at that age, when they're about to go read or stuff like that.
Well, I can imagine, I've got a 4-year-old, and I mean, I can imagine as a 5 or 6-year-old how much energy he's going to have because he has a lot right now. But, if he can't see the board or if that's what he thinks he's seeing and he's not, he's going to lose focus and he's going to start doing something else because he's not interested. He's not engaged because he can't see. And so then now I can see how people can mistake that for ADD.
Right. And they get headaches or they not throw a fit, but, they don't work well with others and so forth. And a lot of a good prevention of this too. We have a infancy program, and I'm an infancy provider.
Cool.
And basically, from 6 months to 1 year, it's an eye exam for free for their babies.
No kidding. Wow.
And they come see me, and dilate, make sure everything's okay health wise, and just where they're at the age where they're supposed to be.
I love that, man. I love that you're a part of that program. I think what's so cool about Southern Plains is that we have all these medical specialties under one roof. So when we were talking about diabetes, you have internal medicine physicians, chronic care management looking over that form of diabetes so they can send them to you.
Right.
We have Dr. Freed, who's a pediatrician who's seen every child in Grady County, maybe. I mean, he's been here for 30, 40 years and has served incredible. So we have all these things to be able to treat patients wholly and in vision. So we actually have Southern Plains Vision Associates.
Right.
You guys are located here in Chickasha, but also in Anadarko.
Correct.
You see patients at both locations, Monday through Friday, 8 a.m. to 5 p.m.
Right.
So they can schedule an appointment, 592-EYES. I love that phone number. So it's 592-3937. You might want to check that out. But very close. But you guys also have full retail.
Right.
right?
Yes.
And so you sell sunglasses, you sell regular glasses.
Yeah.
You have your own lab, so
Yeah.
you can actually create custom lenses. So instead of somebody having to go to like see an optometrist somewhere, then go to like a Walmart or somewhere, they can all just do that within the same hour.
Yeah, and as long as we have, depending to what their prescription, if it's higher prescription, we might have to order that lens.
Okay.
But most of the time we have it, and we do it in-house. Takes about 30 minutes, like
Wow.
you said, and we give them their glasses, and then they go about their day.
That's pretty neat.
It is. We're one of the only places in Chickasha that does that, which is pretty amazing. I mean,
That does full circle, right?
Right.
And then you guys also do surgeries,
we do.
which is very important because what we're talking about develops like diabetes, and when people don't go in first off, or 70, I said half of the people in America by age 75 will be affected by cataracts.
Yes.
And so I know you guys use and work with Dr. John Bellardo, and he's performed more than 60,000 vision corrective surgeries, which is incredible,
Right.
world renowned. So that's really cool. You guys are complete from start to finish.
It is. It's wonderful to have him on board, to be able to work with him side
Yeah.
by side with that much knowledge.
Yeah.
It's always doesn't ever it never hurts to have a second pair of eyes.
For sure.
And I love that. And so he's an amazing guy and a wonderful person to look up to, for sure.
Well, man, I'm so happy you're here. First off, at Southern Plains, we got really lucky, and then secondly, your whole Vision Associates team as a whole. Man, you guys are amazing. I wouldn't trust anybody else with my vision. When my son, he's gonna come and see you, Dr. Gearhart, Dr. Bellardo, and you guys. You need to come get your eyes checked once a year if you have problems, and then every other year minimum if you don't. Dr. Hajjari, thank you so much for your time.
Yeah, thank you for having me.